Monitoring data released by the China Centers for Disease Control and Prevention showed some respiratory illnesses have been increasing in recent months. There have been increased rates of mycoplasma pneumonia and influenza.
因为今年就是从这个春天以来呢，可以说
Since the spring of this year, common respiratory illnesses in children such as respiratory syncytial virus and influenza virus have appeared. Since the summer and autumn, mycoplasma pneumonia infections have been on the rise, reaching its peak in September and October.
逐步攀升的一个趋势。
According to Dr. Tang, in the past few months, there were a lot of mycoplasma infections causing pneumonia, and more children needed to be hospitalized. The recent influenza virus mainly caused fever and upper respiratory tract infections, and fewer children needed to be hospitalized. Tang also outlined the hospital's measures for coping with the surge in out-clinic patients.
实际我们每年我们医院到这个秋冬季
Every year in autumn and winter, our hospital encounters an increase in the number of patients with respiratory infection illnesses. Our hospital has added more than 10 internal medical outpatient clinics in the evening, focusing on respiratory illnesses, and increased the number of doctors attending during the day.
那个科室嘛。
Many parents are worried about infections leading to more serious conditions. Dr. Tang said most of these common respiratory infections, if the symptoms are mild, will not lead to worse conditions. However, some patients, such as those who need to be admitted to an ICU or who need mechanical ventilation, need to be carefully monitored. Doctors advise against panicking or excessive worry about children contracting respiratory diseases. However, parents should ensure their children receive proper and timely treatment. A spokesperson for China's National Health Commission suggested opting for primary medical and health institutions if the child has mild symptoms to avoid long waiting times or cross-infection at larger hospitals.